Dr. Motlagh, thank you so much for joining us here on Health Connection. The title of this segment, Lifestyle and Looks, Facing the Facts, which we all have to face the facts. The first question, how much of a role do bad habits play in how quickly we age?
I think they play a big role, particularly in what we eat. I think the American diet is just really poor compared to other countries. I mean, we eat way too many carbohydrates, for example. We don't get enough exercise as well. Fortunately, smoking is on the decrease in the country. That helps quite a bit. We're educating our kids about sun exposure and use of sunscreen. So I think overall we're getting better. We still have a long way to go. But again, habits, very, very important. It's important for parents to teach their kids, pass on good habits to them so that they can live a little more healthy.
You said habits. What are some of the worst habits people have that affect how old we look?
I think the biggest one, two of the biggest ones are what we eat and smoking. That's really important. We know that smokers come from parents who are smokers for the most part. So part of that you can't help. You can't help who your parents are. Fortunately, you can break out of the cycle. You know, if you're determined enough, or if you have the will, it's very difficult. In my practice, I make a lot of people stop smoking for their surgeries, and that is usually a pretty good deterrent, and because they become motivated to stop smoking. So smoking is a big issue. I know we've done twin studies with smokers, identical twins, one smokes, one doesn't smoke. You look at their faces over time, there's a noticeable difference in aging. And then what we eat. You know, everybody's diabetic these days. Because what? Because we eat out at restaurants too much. The art of cooking has become lost. We don't cook at home, more healthy. Just things like that. I think we have to go back to basics.
Let's go back to what you talked about with smoking. Why does it make you age faster?
Well, nicotine will spasm blood vessels, so there's decreased blood flow throughout the body. And when there's decreased blood flow, there's less nutrients, there's less oxygen. The tissues don't survive as well. There's also a lot of toxins found in cigarette smoke. We know there's hundreds of toxins, from formaldehyde to all kinds of other nasty compounds that cause oxidation. We talk a lot about taking antioxidants, but one of the most powerful oxidants is this. So it oxidizes your blood. It literally rusts you from the inside out, and that's exactly what's going on over time.
All right. We dealt with smoking. Let's talk about drinking alcohol. Does that add years to your appearance?
I think that's a controversial subject. I think it depends on the person. It depends on the amount of alcohol that they're drinking. It depends on their genetics. Some people do okay with alcohol, even severe drinking. Some people, even with moderate drinking, it may affect them to some extent in terms of their skin. I think a small amount of alcohol, as we know, is probably good for your heart. It decreases platelet aggregation. It's relatively heart healthy. But I think you can get the same benefits from just, grape juice and eating grape products, and other kinds of antioxidants. So, I'm not big on alcohol. I think if you drink it in moderation, it's okay. Again, a certain number of percentage of the population is sensitive to alcohol, so they can become alcoholics. Somewhere around 13% of the population will become alcoholics. So we don't encourage that. I think there's other ways to be healthy other than alcohol.
Let's talk about food again, since you brought it up a little bit earlier. Are there dietary choices that age us, and then the American thing, fast food?
I think that varies. I'm not sure if there's a proper answer for that. That's a controversial subject. I don't know if foods will necessarily age you faster, one versus the other. I think in general we should make healthy life choices. We should eat natural foods. We should stay away from processed foods. I think as Jack LaLanne said it best, he said, if it was made in a plant, you should spit it out. If it came from a plant, you should eat it.
Very good. Sedentary lifestyle, been cited as a cause for poor health. Does being sedentary cause you to look older?
It seems that it affects health more than we think. I don't know if it necessarily makes you age faster because we really haven't studied it to that extent. They call sitting the new smoking, you know, in the deleterious effects that it has. So most of us have sedentary jobs. We're sitting 6 to 8 hours a day. The human body's not made for that. You know, we're made to get up and move around. So they say even getting up every 5 minutes, just standing up in your chair is good. Moving your feet around is good. Having a little pedal device is good. Moving your ankles back and forth is good. The human body is made to move. And when we're sitting, we force ourselves into an artificial environment. You know, so can it contribute over time? Perhaps. We just don't know. It may be a minuscule result, but again, marginal things add up over time.
We all know those people that never seem to age, and then we know people that seem to age beyond their years very quickly. It seems genetic. It seems like a predisposition. Is that the case? What are the causes of that?
Probably the main factor is genetics, you know, but a lot of it comes from lifestyle choices, what we eat, if we choose to smoke, sun exposure, activity level, all of these things contribute as well. We're just not sure what the proportion is. I feel that a lot of it has to do with just genetics as well. Oh, and also, I'm sorry, stress. Stress is a big factor. We have to always talk about stress. And that's one thing that I think is downplayed. I think both in the physician's offices or in the media, you know, every single person in this world has stress to one form or another at varying times and at various degrees. We have to understand stress is one of the most powerful factors in our lives. I mean, it will age you very quickly. I mean, for example, you see the president becoming president on day 1. You follow him year 2, there's more gray. Year 3, there's more gray. And wrinkles and everything. That's just a classic example of what happens, you know. But stress, we have to reduce our stress in one form or another through various means.
You've talked a lot here about bad habits. Give examples of what we can do to slow the aging process.
That's a difficult question. Slowing the difficult
But it's why we're here.
Yes, slowing the aging process. We've been trying to do this for eons. As we learn more from science, again, the factors are always the same. Stress reduction, not smoking, eating properly, getting enough exercise. I think those are big factors. And of course, seeing your plastic surgeon.
Well, you segue very nicely into the last question here. For those that want to reverse the ravages of Mother Nature, there is cosmetic surgery and other medical options. Give us some affordable choices for dealing with wrinkles and the things that cause us to look older.
Sure. 2 of the easiest things that can be done non-invasively are the use of Botox as well as the use of fillers. These have become widespread over the last few decades and are very effective. Botox temporarily paralyzes muscles such as forehead, this area, crow's feet. It lasts about 3 or 4 months. It works within a week, and it's very effective and very few side effects. Fillers, on the other hand, have been around for a while, and good fillers, very effective ones, have been here for about a decade. Fillers, for example, will fill in these lines or lip wrinkles or any other wrinkles on the face. Extremely effective, last between 6 and 12 months. So those are 2 very non-invasive ways that can work extremely efficiently. There's some good lasers out there that can resurface the skin as well. There's some chemical peels that work very effectively. And there's always a facelift.
What is a facelift?
A facelift is a way to rejuvenate the face, and it works from here down onto the neck. So a facelift generally includes a neck lift. It's used to tighten up the face. So if you go in front of a mirror and you do this to yourself, that's essentially what it'll do. So it rejuvenates everything from this area onto the cheek and onto the neck. It pulls the skin tight, rejuvenates. And generally, most plastic surgeons in the country will do a facelift in 2 layers. The layer above the muscle is tightened, and that's the foundation of the facelift. And then this excess skin is removed, and the incisions are put in very favorable locations so that they hide very well. Only you know about it and your hairdresser.
Very well. Learned a lot. Doctor, thank you for your time.
Thank you so much.